Greetings to the Makah community. Today is June 10th, 2020. I address you today on behalf of the Makah Tribal Council, Vice Chairman Keith Johnson Sr., Treasurer Patrick DePoe, Councilman John Idas Sr., and Councilman George Chad Beauchamp. The council would like to thank the entire community for taking the COVID-19 global pandemic seriously and adhering to the precautionary measures necessary to protect our village. Due to the entire community's early and ongoing efforts, we have been able to prevent the spread of COVID-19 in our community. In order to continue these preventative measures, as well as make safe adjustments, the Makah Tribal Council, in coordination with the Makah EOC, our Tribal Health Officer, Sophie Tredovic Indian Health Center staff, and other public health professionals, have developed the Makah COVID-19 Public Health Protocols, a comprehensive strategy and phase approach plan based on specific measurable metrics and disease activity and healthcare system readiness. We will utilize this plan to assess disease activity levels and the capacity of our local and regional healthcare systems, and based on these specific measures, introduce new phases safely. This plan will also provide guidance to return to previous phases as needed if disease activity increases, as we continue to monitor the situation locally and abroad. After careful review of the current disease activity and our healthcare system readiness, here in Nia Bay, the Makah Tribal Council approved moving to Phase 2 protocols as outlined in the new COVID-19 Public Health Protocols document. We want to be clear that the risk is certainly not over. However, the disease activity is low in our area, and as such, we are able to move safely into a Phase 2 that's going to allow different activities. This disease is still a very real threat to our community, and it is certainly still safest for people to not travel if they don't need to travel, to stay home as much as possible, and to limit interactions with others. If you do have to leave home, please wear a mask, stay 6 feet away from others, and certainly wash your hands, sanitize your hands, and do those things that we've been advising. Those are still activities that can help keep you safe if you do have to travel outside of Nia Bay. And as you go to public places within the community, we still want you to be wearing a mask and social distancing yourself from those outside of your household unit. So one of the examples of what is allowed in Phase 2, Phase 2 protocols will allow all businesses with an approved workplace safety plan to open. And those workplace safety plans will go through a review process. First, they must be submitted to the general manager, and then they will be reviewed by the executive team, which includes the Makah Tribal Council, the acting general manager, the operations director, the public health officer, and the chief of police. There's also small gatherings are allowed. Small gatherings are allowed outdoors while maintaining social distancing. And once again, masks are encouraged if you are having a small gathering in the outdoors, in an outdoor venue. It's important that during these gatherings that you know the people that are being gathered. What's really important is as we respond to any cases that may come about in the community, we have to know who's in contact with who. That tracing effort is very vital to keeping our community safe, so we can trace and we can isolate and quarantine people as needed if the virus presents itself in our community. So those small gatherings, make sure we know the people that are there and that we social distance, and it's strongly encouraged to wear a mask. Priority individuals who are over 60 with underlying conditions are strongly encouraged to continue avoiding all non-essential contact. Like we said, this virus is still a risk, so people who have underlying conditions, who have health complications, strongly encourage that you continue to avoid any unnecessary public contact. Some things that have not changed in the order: all non-resident, non-Makah tribal members must have Makah Tribal Council approval to access the reservation. So if you are not a resident and you are not Makah, that approval must come from the tribal council to be allowed onto the reservation. And then you must follow the established protocols and the health order that is in place if the council does approve such visit. Non-resident Makah tribal members do not need Makah Tribal Council approval. If a non-resident Makah tribal member is coming from an area of high disease activity, they must contact Public Safety Dispatch ahead of their visit for specific instructions and must quarantine, remain in that household that they're visiting for 14 days. They must remain as a household unit and do their activities together and not associate with other families and with the public in a public space. So, those are some of the restrictions that we will still have in place. We want you to follow proper hand hygiene. Again, we want you wearing masks and strictly avoiding all non-essential contact. We're asking people to be able to read the Phase 2 protocols when they can, if they have access to the technology, to be able to look on the Sophie Tredovic Indian Health Center website, on the tribal websites, the Makah EOC and the Makah portal will have copies of these documents on them. Hard copies will be posted at Ba'is and at the village market. Copies can be made available upon request to public safety, and then the tribe will also be mailing out these documents as well to our membership. So I want to thank the community again for its efforts. This has been a long 3 months for us. You've all done a tremendous job in caring for one another, watching out for one another, and protecting our community from the COVID-19 virus threat. And so we want to mention again that the threat is not over. There is still a threat there, but disease activity is low. Should there be a need for us to revert back to more restrictive measures, we have the ability to do that. But right now, disease activity is low, and so we can loosen up on some of the measures that we're allowing. There's still some of the things that still are not allowed. Non-tribal, non-community members, the tourism that's we're used to seeing this time of year. We're not allowing tourism industry to get fired up and to start moving. So there'll still be a checkpoint in place. The checkpoint will be run differently. If you've already gone through there in the last day, you've noticed that there should be those changes in the checkpoint. So once again, we're moving from Phase 1 to Phase 2 as defined by the Makah Tribal Health Order and the Makah Tribal Health protocols that are available for distribution. Please look those up on the Sophie Tredovic Indian Health Center website and the Makah EOC Facebook pages, as well as the Makah portal. All right, everyone, take care. Have a great day and enjoy the rest of your week. And I'm sure there's going to be questions. We'll have staff available throughout the organization to be able to answer those questions, as well as the Makah Tribal Council is available as well. All right, take care. Sure.